Hello guys, my name is Dr. Abdullah Ashraf. I'm currently an intern doctor working in Jinnah Hospital, Lahore, which is affiliated with Allama Iqbal Medical College. So, over the past couple of weeks or so, I've gotten a ton of messages from various final year students who have cleared their examinations. Many congratulations to them, and now they are basically asking me how to proceed with Housejob. First of all, what is Housejob? Housejob is basically an intern year you have to do in Pakistan before you are recognized by the Pakistan Medical and Dental Council, PMDC for short. And in India, it's the intern year, and you're basically known as the internee over there. But in Pakistan, you're referred to as a house officer. So, what was asked of me in various messages? So let's address one of the major concerns right off the bat. Can you give exams in Housejob? The long and short version of it is yes, you can give exams in Housejob. That is one of the most requested kind of topics that people wanted me to talk about, and I'm gonna start off with that and then we'll proceed further. So can you give exams in Housejob? Yes, you can. Depends on the exam and depends upon the rotation that you choose. So you have three months of various departments that you can go to depending on your own personal preference and how much you scored in final year. But it basically boils down to that. It depends if you're going for the UK pathway or the US pathway. You can't opt for FCPS until you have done your Housejob. You can't give the exam before that. So we're just going to be talking about these two major pathways, and we're going to touch a little bit about the Australian medical licensing exam, and but we're going to be focused on UK and US pathways. So first of all, UK pathways. For the UK pathway, after you have cleared your final year, I would recommend that you book your occupational English test, OET for short, as soon as possible, because the seats, like, they go away in like a flash of a second or so. So be sure to book your OET as soon as possible. OET is a little bit easier as compared to IELTS. However, it's a bit more on the expensive side. So that's why if you feel like your English is good, you can communicate well, you can opt for IELTS. It's cheaper, and there's not a lot of saturation in IELTS, and you can get a seat over there. But in OET, a lot of students are booking it, people who have graduated, people who are yet to graduate, people who are going to get their certification for US. So there are various reasons why you would want OET done. So my first recommendation for the UK people would be book your OET as soon as possible. And once you've cleared your OET, you need to score a 350 in all subtests: speaking, reading, writing, listening. You need to score a 350 in all of them to be able to be recognized by the General Medical Council to be eligible to book the exam. So I'll make a separate video on OET. This is not an OET video, but I'm just telling you guys to book the OET in advance, because the seats they go away like they're just gone. Okay. After you've cleared your OET, then the General Medical Council of the UK, GMC for short, releases PLAB 1 seats, or after August it's going to be the UK MLA, or the United Kingdom Medical Licensing exam. They're going to release the seats for that, and we don't know the exact dates of when they're going to release the seats, but round about 2 years or so, they only released it 2 times per year. But now, since there are a lot of doctors opting for the UK pathway, they release seats around 4 times a year, and we are probably looking at June or July when they release a further subset of seats, but we can't know for sure. This is all dependent on whether they want to release seats or not, but most probably June, July, August. June, July, August would be, I don't know if they do that, but this is round about the time when they would want to release seats. Let's talk about the US pathway a little bit, and we'll come back to how we will manage exams with Housejob a little bit later. Okay, so it depends if you're giving step 1 or step 2. Step 1, it's a pass-fail exam. You can give it in majors, minors, it doesn't matter a lot, because you have to study a set amount of material, and there's not a lot of things that you have to kind of go through. You just have to do UWorld, and you have to do first aid. It's a lot of information, but at the end of the day, it's a pass-fail exam. So you can give that whenever you feel your preparation is adequate. Step 2, on the other hand, is score based. That means the score you get will determine your chances for residency, along with a lot of other compounding factors. But the score is very important when it comes to residency. So that is something that you should consider. For step 2 or PLAB or anything else, basically, how to approach an exam. Well, you have your rotations, medicine, surgery, and 2 minors. Medicine, surgery are fixed, you have to do them, and the minors are variable. And so basically you have to juggle the major rotations with the minor rotations and choose rotations which are kind of on the lesser spectrum of workload, and basically pick that date within that rotation. So what I would recommend, if you're booking the PLAB 1 examination, and they will probably release seats for this in February and May, if you book that examination, you will need to book a minor rotation in the last 6 months of your house job. With basically, you should do your majors first, medicine and surgery, and then you move on to minors, because they will release seats for next year. So basically, the last 6 months of your house job should consist of minor rotations which aren't as hectic, and in which you can clear your exam easily. What are minor rotations? Basically, minor rotations are specialized kind of divisions of medicine and surgery, such as ophthalmology, such as cardiac surgery, in which they don't expect a lot from house officers or intern doctors, and they kind of do the work themselves. Obviously, you will be doing documentation and clerky, but that's kind of part and parcel of house job in any rotation. So book your seat then. And what minors I would recommend? I would recommend ophthalmology, and I would recommend cardiac surgery. These are definitely very, very kind of relaxed environments, very, very easy rotations for house job, especially in Jinnah hospital. So definitely consider that. For step 2, because usually people who are giving step 2 have cleared their step 1 before house job, or are in the process of doing so, and you want to immediately jump from step 1 to step 2 as the information just carries on into the next exam. What I would recommend is basically using your minor rotations within the first 6 months of house job. So it's kind of the opposite as opposed to the UK pathway. You're going to choose the minor rotations first. I've talked about the minor rotations. Choose them first, study hard, give your step 2 towards the end of your easy rotations, and then you just have to do medicine and surgery. It's going to be a little more gruesome for you because you're not used to the high workload of medicine and surgery in the last 6 months of house job. But if you have to complete house job and it is a priority for you, then this seems like a very logical way to approach step 2. Talking about rotations, I myself chose medicine 2, surgery unit 4, anesthesia, and I am currently in ophthalmology, eye. So I chose medicine 2. It is the best medicine unit, hands down, because of the head of department, Dr. Shahid Sarwar. He is a professor who invests so much time in his house officer. I don't think any other professor does that. Dr. Shahid Sarwar takes a lot of time and invests in you, and he wants something in return. Basically, he wants you to take care of the patient. He wants you to examine the patient, take proper histories, and basically you're so kind of adept at managing 5 or 6 patients simultaneously. I even had 7 patients in a go at once during my rotation, and you become so kind of used to that your skills are really refined in medicine too. But if you want to you're not interested in medicine and you're not that enthusiastic about medicine, I would recommend medicine unit 1 or medicine unit 4. They have the kind of perfect balance of teaching you stuff and being a little lighter on workload. That's my recommendation. For surgery, I chose surgery unit 4 because I had no interest of going into surgery. And if you don't have interest in going into surgery, I would recommend surgery unit 4. It is a very relaxed rotation in terms of majors, and all the postgraduates are very nice. They kind of help you out, but it's a very relatively mild rotation, and you can even give exams in surgery unit 4. It's that kind of that easy. Okay. And especially if you've done medicine unit 2 and then you move on to surgery unit 4, you're going to feel like it's heaven. But if you want to go into surgery, I would recommend Surgery Unit 1 or Surgery Unit 2. These are both very good rotations to choose. Surgery Unit 1 especially, if you can handle Surgery Unit 1 and you like Surgery Unit 1, surgery might be for you, and you should seriously consider going for Surgery Unit 1 if you want to go into a surgical specialty. But not, you're interested in medicine, then I would recommend Surgery Unit 4. Minors we've talked about. There are a lot of other minors. There is dermatology, there is pulmonology, there is anesthesia. Now anesthesia, I would recommend every house officer to take anesthesia. Again, it's my personal choice, but they teach you a lot. They teach you intubations, they teach you lumbar punctures, they teach you spinal anesthesia, they teach you proper cardiopulmonary resuscitation. The first successful CPR I saw in Jinnah Hospital was in anesthesia, and they follow protocols very, very strictly. So securing IV lines, doing all that, I would definitely recommend anesthesia as a rotation. It is one of the best rotations in Jinnah Hospital, Lahore. But again, it's up to you. And it does involve documentation. That every rotation involves documentation, so don't worry about that. You kind of have to accept documentation and clerky. Whether you are in Pakistan, US or UK, the first year of any kind of practicing year is going to involve a lot of documentation, a lot of noting down stuff and filling out forms. That's part and parcel of being a doctor or being a very kind of internee. Moving on to miscellaneous questions. One of them would be, what is the environment for private medical graduates or foreign medical graduates in Jinnah Hospital? Well, the opinions are kind of mixed. There are some people who bully you for being private medical graduates or being foreign medical graduates, but overall, I would say that you have to focus on your own career, and you will find these people anywhere. Jinnah Hospital is definitely worth doing, because if you tell someone that you did your house job in Jinnah, immediately your credentials will be boosted, because they know the workload and the resource kind of limited environment of Jinnah. And if you can come from that, you can go anywhere. That is why I would definitely recommend Jinnah. Yes, there is a little bit of bullying and a little bit of leg pulling in Jinnah Hospital, but you have to face it if you want to do house job in Jinnah. You will not be paid for a house job in Jinnah if you are a private medical or foreign medical graduate, so you have to consider these things. There are some options. Sometimes our own alumni kind of leaves the house job and paid positions open up, but it's not a kind of hard and fast rule. It's variable. I recommend Jinnah for someone from a government medical college? Not really. I think you are pretty much okay if you're doing Jinnah in your own kind of institution. It's fine. Obviously, I'm a little biased towards Jinnah because it is my parent institution. But if you're a government medical student and you have a hospital for you, I would just recommend going to that hospital instead. Now let's talk about a few more topics, and that is, what's the overall environment for Jinnah for everyone in general? Look, house job is not it's not easy. It's definitely tough. It's a job, and sometimes it's not a job. Sometimes in the minor rotations it doesn't feel like a job, but in the major rotations you understand, okay, this is what being a doctor is. But you gain enough skills that if someone is dying in front of you, you know how to resuscitate them or get them to the hospital at least.
House job versus no house job, that depends on you. I am kind of biased towards house job. I think everyone should experience what it means to be a doctor before you enter any foreign kind of exam or a foreign system, because you learn a lot, you make a lot of mistakes, and you learn what it means to be a doctor. And sometimes it's not the glamorization that we see on the internet or on TV, but it's a lot of documentation, a lot of deaths, a lot of sadness, and we have to face all of that. So I would definitely recommend house job. If you have any more questions, feel free to comment them below. I'll be sure to answer them in my next video.
I hope you guys have a great day. That's all from me. Allah Hafiz. Goodbye.